You've probably forgotten what it feels like to open your eyes in the morning and just see clearly. Some of you may never have known what that feels like. You'd love to be able to pick up your phone or a book or see how much salt you're putting on your food and not have to hunt around for your magnifiers or your reading glasses every time. And you know what the most amazing thing about laser eye surgery is? Even after years of wearing glasses or contact lenses, and even with very poor eyesight, within a few weeks, you're hardly going to notice it at all. Your brain will adjust to this new reality incredibly quickly, as if it was saying, well, of course I can see clearly all the time. That's what your eyes are supposed to do. In fact, from what we've seen over the years, the things that take the longest to go away are those automatic reflexes of just pushing your glasses up or adjusting them from around your ear or reaching over to your bedside table to sort of grab your glasses first time in the morning, only to realize that, wait a minute, I don't need them anymore and I don't have glasses anymore. You'll quickly be so accustomed to having normal vision again that it's only these tiny little quirks that will remain and remind you of what it used to be like. But let's be honest, you don't really need us to list the reasons why you want to fix your vision and why being able to see clearly without glasses or contact lenses makes such a difference to daily life and why it makes sense to everything. You already know all those reasons for your own eyes and your vision and what it could do to change your life. Many of you might have very specific reasons why you might want your vision corrected. We've had, great stories over the years from our patients. So for example, wanting to surprise a partner, to rowing across the Atlantic, airline pilots who, when they become presbyopic or have the aging eyes, they actually find it difficult because no one pair of glasses works in a cockpit which has 7 different distances that they have to be able to see through. Or maybe you're just fed up with wearing glasses or poking your eye twice a day with the contact lenses in and out. And then there's people who actually become intolerant to contact lenses and they're told they have dry eye and they can't wear them anymore, but actually they don't have dry eye, they're just intolerant to contact lenses and they want to be able to see without a prosthetic on their eye, and that is laser eye surgery. With laser eye surgery, the question for people isn't, do I want this? Because no one really wants to depend on glasses or contact lenses to be able to see. Everyone knows that. Everyone knows they want to have natural vision. And with 70 million procedures done successfully around the world, laser eye surgery is an exceedingly well-established, safe and effective procedure. What you really care about is this: can you trust a surgeon to have all the knowledge, the technology, and the ability to offer you the best option for your eye and give you the best outcome possible as safely as possible? That's the most important part. After the surgery, when you can literally see how well it worked, then it's easy to know you were in good hands. But the time leading up to it, you're certainly going to be a little bit nervous. That's normal. If you weren't, that would be denial. Even making this decision to continue listening to me right now, there is that small fear of the unknown and who should I go to and who can I trust? You don't have anything to compare it to. So how can we put your mind at ease? How can we show you that there is literally no place in the world you could trust more with the health and function and safety of your eyes? People come in here and say, well, we came to you because you're the best. My answer to that is, I don't know about the best, but I do know that we are second to none. The point being that there are a lot of practitioners out there who are very good. But as a layperson, how do you know how to distinguish this? You haven't gone to medical school and done an eye surgery residency to know enough, to ask enough, to know who you can trust. So in the next few minutes, I'm going to show you that there is literally no place in the world you could trust more with the health of your eye, the function, and the safety of your eyes. So to answer that, let's go to what is the most common vision correction procedure that we perform at the London Vision Clinic. The most common is that we use laser eye surgery to correct both regular distance vision, and near vision simultaneously. Now here's something that you probably didn't know. Until our 40s, the eye is able to change focus from distance to near and back to far whenever you want. Most people can go completely unaided and see everything at distance without glasses, but once we reach our 40s, this changes. So like the zoom mechanism starts to weaken. If you're short-sighted, where you're naturally focused up close, so you'll need distance correction, you'll have to take your glasses off to see up close. If you never needed distance correction, you'll start to have to hold things further away, and then when it's too far, you'll have to start putting magnifiers or reading glasses or use bifocals. In the past, you couldn't fix this in older people with laser eye surgery. The only way to solve this problem used to be to have the natural lens inside the eye removed and then have a new multifocal synthetic lens implanted. These multifocal lenses split the light going inside the eye so that the brain, and most people, learns to pick which one of the three images to pay most attention to. But it's far from a perfect solution. But now, over the age of 45, you can get distance and near vision corrected at the same time by laser eye surgery because we invented it. I wasn't happy with the multifocal lens option that was available 20 years ago. The lenses have improved a lot in the last 20 years, but back then, the multifocals really had severe side effects. So I worked with my colleagues to develop a method of extending the depth of focus of the eye with a simple laser eye surgery. The same one that takes just 3 minutes to allow us to correct for aging eyes which have a near vision problem as well as a distance vision problem. So this invention, which we originally called laser blended vision, was then adopted by the #1 laser eye surgery company, optics company in the world, Carl Zeiss. And this method is now available commercially around the world, and we call it Presbeyond. The Presbeyond method has become so successful that we have trained thousands of doctors from all over the world on how to do it. The data, the results from around the world clearly shows that not only does our procedure have the highest accuracy, but it also has the least side effects and the lowest complication rate and the fastest adaptation time. It's better for your eyesight and it's better for the health of your eye. Now, we published the first papers over 15 years ago, but there are now many scientific publications on this technique from others around the world who have also been producing equally amazing results and achieving complete or near complete independence from glasses without affecting night vision or contrast. And it's adjustable. So if the eye happens to change over time, it's not a piece of plastic. If it does change, it can be adjusted. And in the very unlikely event that it is not well tolerated, it's actually reversible. And like all laser eye surgery, we at the London Vision Clinic have the expertise to deal with even the most rare complications that can occur. For us, it is most important that everything we say about our outcomes is verifiable, proven, and can be checked by the professional community or anyone else. That's why we publish all of our clinical results in scientific journals so that they are anonymously peer-reviewed and confirmed. That means that if we say we have the best outcomes, that's not marketing speak, that's not pulling in results out of a hat. That is actually backed up by the scientific publication method. I'm sure that this transparency is why the procedure, which we invented, is becoming the gold standard for vision correction in presbyopia or aging eyes. And that's why when you come to our clinic, we feel that our job is not to offer you a big range of options and let you choose. It's not a menu. No, we tell you what procedure we think is the best for your eyes, for you to get the best outcome with the lowest risk of complications and the best range of vision with the best quality of vision. We discuss procedures that we do not perform because we do not believe in them, so you also have the context of other options in your decision process. And we will encourage you, if you so wish, to see other practitioners and make your informed decision. And we'll explain why we're choosing that procedure, because we have almost certainly the most complete laser eye surgery data set in the world, which enables us to confidently give very accurate statistics on our own practice, behind every single procedure and behind every single recommendation, even for the most rare occurrences that can happen. And finally, just so that you know that it's not all cold-hearted data, both my associate surgeon Glenn Karp and I have performed this procedure on each other, so we know what it feels like to be on your side of the table. So basically, we are our own patients. So in our case, we knew what we had technically. We knew that the best treatment for aging eyes in the world, from both a technology standpoint and from the standpoint of our protocols and surgical training and safety, was what we thought would be best for ourselves. But we also knew that the surgery itself is only one part of the whole. There were still 3 areas that we wanted to perfect to make the whole process as smooth and as stress-free as possible for you. Having the most comprehensive evaluation and face-to-face time to exclude those who are not ideal candidates, and to enable our patients to understand everything that they need to understand to make an informed decision, is our goal. Secondly, caring for you after the procedure was done. That's very, very important to us. And finally, helping you manage the cost. So this is what we do to solve these. So how does this work? Well, first, we gather information by telephone to screen for basics about your prescription, about your individual visual needs, about what you're hoping to achieve, as well as the specifics about your eye health. Once you've made a decision to check this further, we'll book you in for an in-person initial consultation for all of the information to be reviewed and for us to do special testing so that we can recommend the optimal procedure for your eyes. And we'll walk you through the evidence and the data behind this choice. We'll also go over all of the expected outcomes and the risks so that you know exactly what to expect and what you'll experience during the procedure and what the likelihood of a great result is going to be. Typically, our patients go from the first call to the procedure in about 3 weeks, but it can be faster and it can be slower depending on individual preference. Any time during the process, if you have any questions, we have a team ready to answer. So we don't want you to be stressing out about some particular issue. Just give us a call and we will go through everything relating to that extra question or as many as you have. Our goal is to give you the most personal, tailored experience so that you feel comfortable at every step of the way and that you can feel that this is about you and we care intimately about getting you what you want. We also want to do this in a stress-free way. I always say to people that performing the surgery perfectly every single time is only 50% of my job. The other 50% of my job is to manage the naturally occurring anxiety around a procedure like this. And one of my professors when I was training in casualty used to say to me, knowledge dispels fear. And that's, I think, what applies very much so to laser eye surgery. Now, as you can probably hear, I'm American, but I've lived most of my life in the UK, 50 years in the UK. So what I'm about to say is a little awkward. Now, our expertise is second to none in the world. So that is why a number of patients come to us when they've been rejected at other clinics that might have been telling them that treatment was impossible, or the situation where people are told that laser eye surgery cannot correct their condition. The fact that we are able to offer all of the vision correction options at all ages means that we are in a position to choose the best procedure for your eyes, as opposed to a clinic that might only have certain options and that's all they're offering. So for example, our expertise enables us to treat prescriptions that are sometimes considered out of range by standard surgeons. And because we offer expert laser eye surgery to a higher range, and ICL, implantable contact lenses, as well as lens replacement surgery, we're in a position to pick the best option for that particular eye, even if others might have considered one of the options that we select to be out of range. So for example, some people are told that their prescription is too high for laser eye surgery and that they have to have an implantable contact lens, an ICL, put into the eye. In our clinic, there are a number of patients who are told this, where we find that actually the better option is to stay outside of the eye and perform SMILE or LASIK as a laser eye surgery. So in setting up this practice from the get-go, my intention was that we would have us be the final destination for patients who are tired of being told, no, you can't have your vision corrected. We have invested heavily in diagnostic technology and of course expertise, with more testing equipment per surgeon than any other clinic in the world for standard tests that are normally done before to evaluate for laser eye surgery. But it's not just the routine equipment that's used by most clinics. Having more diagnostic power is one of the ways that we're able to do more for the 10% of people that were told they were not good candidates by a good standard provider, especially when the problem is more complex. Now let's come to the question of aftercare. We don't just send you back to the care of your local providers in the early phase after treatment. Even if you're seeing perfectly in the first month visit, we still bring you back no matter what, and no matter how well you're seeing, no matter how well you think you are, we still bring you back up to the 1-year checkup. Why? Because we want to make sure that we've done the best we can for your vision. And because some of the things that we may be able to see on examination are not things that you may be aware of, we want to be the ones to detect that, to not just be able to optimize your outcome, but also to ensure your long-term results. So we want to keep an eye on you, pun intended. So this is what aftercare looks like with us. So most clinics will stop tracking patients at about 1 month or maybe even 3 months after surgery if they're seeing well and they've healed. And that works almost all the time. But our approach is to ensure that everyone achieves the best vision that we're able to give them. We like every patient at 1 year after surgery to come in for us to assess their vision after it is completely settled and some. This enables us to bring people from a good result to a great result, even when they weren't aware of the deficit. Most providers stop at the patient is satisfied point, but we go the extra mile because we're able to measure objectively how well one is seeing, and even if you're satisfied, we can actually show you the part that we can still improve on. And that's, I think, one of the reasons why our outcomes published in the literature are second to none in the world. During the year of follow-up, our customized approach to your aftercare means that we'll schedule as many appointments as necessary to guide you through your recovery and healing. And finally, my business partners wanted to make sure that despite our higher fees for the increased service that we're delivering to every patient, it should still be affordable to anyone who's contemplating vision correction. And that's why we've set up arrangements with a financing service that makes this affordable. That means that you can set up affordable monthly payment plans, typically with 0 interest for a few years, and it's just about helping you split the payments if you want to. So we hope that's answered some of your general questions about what London Vision Clinic does. And of course, there will be a lot of specifics about you, your eyes, what you need, that we would want to go over with you individually. And so here's what you need to do. If you're wearing glasses or contact lenses, you probably would prefer to be able to see naturally. So something is holding you back. Something is stopping you from making that decision to get vision correction. Click below and book in a short call so that we can learn more about you and make sure that you're a good fit for what you would like to have, as well as answer any specific questions that you might have. Once you've armed yourself with the correct information, and we've dispelled all the myths out there about laser eye surgery, like we cannot correct astigmatism, or we cannot treat aging eyes, or it doesn't last, or it's only for short-sightedness, just all of these myths. Yeah, then with that knowledge, you can decide if this is something for you or not. But there is one small request from our side. We're not some giant team with offices all over the world and generic call centers. We're a small, dedicated team of eye specialists based in London. So please only book a call if you're already serious about the idea of having your vision corrected. Of course, you'll need plenty of information and answers about your specific situation in order to make the best decision for yourself, and that's why we want to talk to you. So if you're just a little bit curious about the process rather than ready to act, it's probably best not to book a call. We've got great information all over our website and on YouTube, and if you search London Vision Clinic TV, you will find us on YouTube. But if you're really fed up with not being able to see, and you're ready to find out why laser refractive surgery or vision correction is one of the safest options for vision correction for you, the way to make the right decision for yourself about which procedure to get and how it all works is to call an expert and to get transparent, reliable, honest information from highly qualified professionals. If that's the case, click the button below and book a short call. I know that you will find our staff very informative, not pushy in any way, and eager to see how we can help you get clear vision without the prosthetics of glasses and contact lenses. Just click below and book a call.